Hi, I'm Dr. Mike Carberry, and I'd like to talk to you about the purpose of an integrated practice in healthcare. Integrated, we mean working with different professions together on the same patients. It's not a multi-discipline practice. It's an integrated practice, meaning the teams are working together. Medical working right alongside chiropractic, right alongside rehab. So let me explain that and why we should do it. So in healthcare, there's a couple things that I see that are not really good. Number one, we've been told a lie in healthcare, and that lie is that the job of the doctor is to get rid of the symptom. And that is not necessarily true. Our job is to help the patient to heal themselves. Deepak Chopra, medical doctor from Harvard, was quoted saying that the best tool the doctor has in his arsenal is the patient's body, because the patient's body can heal itself. So the job of the doctor is to figure out, why is that body not healing itself? The state of health is a state that should be a normal state, and it should be that your body can actually work back towards that. That is what we call homeostasis. So chiropractic's been around for 130 years, and in that 130 years, we're still seeing 10% of the population or less, and that's not good. I read a quote by Forbes magazine which said, "Chiropractic may be good for some who want a drug-free approach, but will never surpass traditional treatment." What is that traditional treatment? Traditional treatment would be what happens when people go with back pain to the doctor. They go to a family practitioner or they go to a specialist. They're probably going to be put on some sort of pain med. There's a good chance that that pain med may be an opioid, depending upon the severity of the pain. Is that really to help the patient heal himself? I don't think it is. See, an opioid does nothing but cover up the pain. And let's assume there's no problem with addiction. It's still just covering up the pain. It's making that patient less aware that they have a problem. The problem is chronic degenerative arthritis that's occurring inside their body, probably at their lower back or wherever it is. So if they're less aware of it and it's still degenerating, that's like having rust on the wing of an airplane and just flying anyway because you painted over it, you couldn't see it. Eventually that's going to cause a problem. And the same thing is true with covering up a symptom. If you take a drug to stop a symptom, I'll give you an example. Anti-inflammatory, okay? Is inflammation good or bad? Inflammation is your body's attempt to heal. Well, it can cause pain if there's too much inflammation, but why is the body having too much inflammation? It's having trouble healing. So the purpose of medically integrated practice is to bring together a functional correction in a medical setting. So for example, in an integrated practice, in our integrated practices with AMI, we're not prescribing pain meds. We're not prescribing opioids. We're not prescribing antidepressants. That is the latest push now. I read articles from Harvard that says, since the part of the brain that perceives pain is also the part of the brain that perceives depression, somebody who's in pain must be depressed. Therefore, we need to treat both the pain and the depression, so we can give people pain medication plus antidepressants. That's not looking at a functional correction. Why is this person having depression? Why is this person having pain? It's not looking to see why. It's just saying, what do we do about that symptom? So when you start mixing in antidepressants, it gets a little bit dicier. Why do we give these patients all these different medications when we could actually fix the problem? When I first integrated my first practice in Pennsylvania, I had medical doctors that were willing to help people get off medication. So when we first started, we had medical doctors sitting down with patients, and I would go in with them because they were my patients. And I wanted to protect them, to make sure the medical doctor didn't start writing a bunch of scripts. And early on, I had a patient come in, and I'm sitting there with the medical doctor, and the patient's sitting there, and she starts to read all of her health problems and all of her prescriptions. So what the medical doctor said was, let me get this straight. And she didn't give him an order. She just said, I'm taking this for this, I'm taking this for that, I'm taking this for that. And he said, let me guess. First thing you had was this. She goes, that's correct. And they prescribed this. That's correct. And then you got this. Yeah. And then they prescribed that. And then you got this. And then they prescribed that. And then you got this. And then they prescribed that. I went through the whole list. And she was like, that is amazing. How did you know that? And he said, because if you stop taking all your medication, you'll be back to the first complaint. All of your other complaints are coming from the medication you're taking for your complaints. That really stuck with me. When I heard that, I realized our whole system is just to cover up symptoms. And if you cover up symptoms, it doesn't make the patient any better. It actually makes them worse. So what our emphasis should be on is, how do we treat pain in a way that corrects the problem that caused the pain? That's a little bit harder, but it requires a functional correction. That's what we do in integrated practice. we're looking to see what caused that problem. Is it that the vertebrae are not moving independently and imbibing fluid into the L5 disc, and now the L5 disc is getting weak and pushing on the nerve? Is it that those facet joints that have proprioceptors in them are not stimulating those proprioceptors to the brain and stopping some of the brain activity? That also is a possibility. My wife's specialty was, she was a head injury specialist as a physical therapist. And the way they would wake people up out of a coma is load their weight-bearing joints on a tilt table while the patient was still in the coma. So it's important that all those weight-bearing joints are moving independently. We know as chiropractors, that's what we treat, non-moving weight-bearing joints. So if you start putting this together, you go, well, what's the functional correction then? What we found is by taking a patient who has a long-term chronic problem, and we start to treat that long-term chronic problem starting at the spine by initiating movement at the spine. That does help that disc, it helps those facets, and it even helps take some of the pain away. But what happened along the way is that patient didn't start last week with that problem. They started probably 10, 15, 20, or 30 years ago. And they forget that it was the time they flipped their pickup truck while they were in college that caused the problem, or when they were playing football, or when they fell out of a tree, or when they had a car accident. See, this is what causes these problems. And then what happens is people start to alter their posture to adapt to the pain. Somebody injures L5, the first thing they're going to do is shift their head forward. When they shift their head forward, now it takes pressure off the back, they have less pain, they conclude, oh, I must be fixed. They're not. The problem is still there, degenerating, and they're altering their posture at the same time. If you come along as a chiropractor and you work on that adjustment to get that motion back, that's fantastic. But if you don't address the posture, it's going to come back. And that's what I noticed. It kept coming back until we started addressing the posture. The postural correction that we went with is upper cross, lower cross syndrome. This is working on muscles that become really tight because you change your posture versus the muscle that become really weak because you change your posture. And if you start to work on those muscles, doing things like trigger point injections or stretching with assistance in a rehab setting, and then strengthening the weak muscles, you can actually start to get a permanent correction, a more permanent correction than you could if you're just adjusting. So the adjustment is fantastic. The medical services that go with it are not just for billing, but for actually improving the outcome of the patient, better long-term outcome and faster outcome. So you're addressing the functional component that they cannot do. If their part of their body is not working and you address that functional component, you find out, well, when you have back pain, what is it that you can't actually do? Well, I can't ride a car for more than 15 minutes. That's a functional deficit. So if you start to document that while you're doing the treatment, and as the patient starts to recover, you start to notice they can now ride a car 20 minutes, 25 minutes, 30 minutes. You're proving that what you're doing is medically necessary to fix that patient. Most other offices out there do not address this. Most other offices, you walk in, they go, back pain? We should give you something for back pain. Here's a prescription, an anti-inflammatory, muscle relaxer, an opioid. Now, to show you how out of control it is, the treatment of opioids, use of opioids treating back pain started in about the 1990s. Since that time, we've gone from an average of 11,000 people dying of an overdose in this country a year to 150,000 dying of an overdose in a year. And it's estimated by the Lancet Medical Journal in England that from now until 2030, which is 8 years, 6 years now, when they wrote this, it was 8 years. They estimated 150,000 people a year would die from opioid overdose in the United States. And the number one thing is prescribed for is back pain. So we've gotten way out of control. It is now so common for Americans to die of an opioid overdose. It is the number one cause of death in the United States for Americans under the age of 50. So if you go on the CDC website, they'll have a map there showing you how the number of prescriptions have decreased over the last 10 years, which is true. The number of prescriptions have decreased. But the problem is, it isn't the number of new prescriptions, it's the number of later prescriptions. These people are still getting addicted, and we still have record death rate from opioids in this country. There's a big market for this in this country. If you look at the numbers, chiropractic profession in this country generates about $15 billion a year. But treatment of pain in this country is $800 billion a year. And if you look at pain in the spine, neck and low back, The Institute of Health Metrics and Evaluation of the University of Washington Medical School says 60% of that 800 is for spinal pain, which is $480 billion. That's a lot of money. That is why nobody's taking the steps to try to get a functional correction of these people. Well, at AMI, we recognize our job is not to cover up their symptoms. At AMI, we recognize the job of the doctor is to figure out why is a patient having symptoms, what is not working, get that working so the symptoms go away and stay away. That would lead to a healthy population. That is the purpose of why we do what we do. I do not believe that healthcare will be able to sustain itself at the rate it's going by treating people this way. It's not going to work. We have people actually dying from it. I mean, that's not my opinion, that's a fact. So if we actually start to treat people in a functional manner, where we're breaking it down granularly, well, we got to get the vertebrae to move in its proper direction. That's chiropractic adjustment. Well, we got to get the musculoskeletal system balanced so that the posture restores to normal. That's the physical therapy or rehab component. Well, we got to break up adhesions in the muscles that are developing these adhesions because they have trigger points because of the postural changes. That's a medical therapy. And working together, all these things can be combined to get a very non-drug approach. When we're treating things like the trigger point injections, we're not using cortisone because cortisone is a steroid hormone, and when you put a steroid hormone in your body, it throws all the other hormones out of balance, which is why too many steroid injections cause diabetes. It can cause depression. It can cause memory loss. People don't realize how dangerous these things are. So I just read an article from the British Medical Journal saying that there was a significant increase in the case of acute coronary syndrome, which is heart attack, for people to get steroid injections. You know, you look at it and go, well, all those weightlifters, the powerlifters, and the wrestlers that were doing steroids, a lot of them died of heart attacks. Well, that would make sense then. So why are we using these dangerous drugs? We don't use those in AMI. What we're doing is very conservative things. We're doing trigger point injections with lidocaine and very non-invasive drugs like Tramiel, very safe drugs, been on the market for 100 years. Lidocaine is 99% saline solution. So we're using the mechanical agent, not the chemical agent, to break down the adhesions, meaning that we're using the fluid to break the adhesions. We're also using regenerative medicine, PRP, things like that can help people get to levels of improvement that we haven't seen before we started using those things. So it's combining these different treatments together in a toolbox, led by a medical team that has a chiropractor on it. We're not prescribing family practice meds or any of those other meds. There's plenty of places they can go for that. What we're dealing with is how do we functionally correct this condition of a back or neck problem. And that starts to bring in hip problems and knee problems and ankle problems and shoulder problems. And how do we treat them in a way that we can actually get these patients corrected so their symptoms go away and stay away? So that's the purpose of why we do an integrated model. We are trying to actually introduce an idea that's been around for a long time. I didn't invent all these things, I just kind of put them together. But it helps people get well in a way that their problems are as close to being corrected as you'll ever get. It's not just covering up the problem, it's actually improving the condition of the body so the body can function without pain. And then therefore it doesn't have to have pain medication. So if you're into an idea of helping people with chronic pain, helping people with chronic degenerative arthritis, that's what we focus on. We would love to hear from you. This is what we do. And we think we need more clinics like this, not less clinics like this. So hopefully you'll join me in helping me change healthcare for the better. If you want more information, you want to hear from us, you want to reach out to us, click that link, and that link will connect you to us, and you can find about the blueprint of our model, and you can learn all about that by clicking the link.